I'm absolutely bowled over and proud and delighted to introduce you to our next speaker, who is Professor Sir Eldryd Parry, who has become the patron for our new charity, which is just, in my eyes, astounding. Now, I need to tell you something about Sir Eldryd, but it's quite long, so I'll cut it short, because Sir Eldryd has had a very long and illustrious career. And Sir Eldryd studied medicine at Cambridge, and he's spent a lot of his career, well, all his career, I think, in tropical medicine. Was in Nigeria for a long time. In 1980, he went to Ghana and opened a medical school in Kumasi, the second city of Ghana. He's the editor of a very significant textbook for Africa called Principles of Medicine in Africa. He's published widely on tropical cardiovascular infectious disease. 1988, 20 years ago now, he founded the Tropical Health Education Trust, which is what, I mean, we wouldn't be here either, I think, if it wasn't for the Tropical Health Education Trust, because that organisation has done tremendous work putting the NHS in contact with low-income countries, just like our Kintampo Trust. In 1982, he was awarded OBE, and more recently was knighted as in the most distinguished order of St. Michael and St. George. I'm not used to announcing knights, but this is it apparently. So, Sir Eldryd, you are very welcome. And one other thing I would just like to say about Sir Eldryd is that he leads a frugal life. And my email last night from Sir Eldryd said, Mark, which bus do I catch from the train station to the stadium? So, of course, we sent someone to get him from the station. But Sir Eldryd, would you please come up? Thank you.
Well, I think the only reason for the bus was I didn't know I could bring my bike on the train. Well, thank you very, very much indeed for the warmth of your welcome. And can I say what a privilege it is for me to be here. It's quite emotional, really, because my wife and I spent 5 very meaningful years in Ghana. We made very great friends. It was a time of difficulty in the country. There was a drought, there was a coup, there was a curfew. Electricity came on alternate days. And yet in that time we were able to train splendid young medical officers, as they were then, who are now running the medical school. And Mark came along after that. And as a result of that, we're here today. And I would pay a tribute to Mark for all that he has done and for his energy. And I was delighted to hear the Chief Executive, Madam, address you thus, say how important this was for the NHS also. And I endorse that wholeheartedly. This is a partnership, and it's the Kintampo Trust is looking perhaps as a local organisation, but it could not exist if it were not on the basis of a strong partnership. And I believe that what you are doing is strategic for the NHS. It enables us to display in a very professional fashion what is best in international development, that is working together towards the goals of our overseas colleagues and not what we think they need. Now, so much aid is, we will come and do this for you. How arrogant. When I was dean in Kumasi, if somebody came from London or Boston or wherever, or Bonn, and said to me, this is what you should be doing, I'd quietly escort them to the door. Where else? And Dr. Adjasa, being here, endorses this. He will say to you, this is where we should be going. Come with us. but I'm weak in this, but I haven't got that. Can you help me? And that is how this sort of partnership must and will, I'm sure, develop. And I would like to take that further by saying Kintampo isn't only mental health, but of course, therefore, there's going to be a bigger challenge, perhaps to the trust and perhaps to others around, to move this wider. And I've seen, for example, other trusts do something very similar, starting perhaps small and showing it can work, and then moving out and you passing on to surgeons or to others, all that sort of work which can be done to develop the skills of this critical middle ranking group of officers. The fact that you're training medical assistant psychiatry is very strategic, because this is the middle level group who are going to meet needs in Africa we doctors won't. But such middle level, trained for specific tasks, are the backbone. Uganda has had psychiatric clinical officers for years, and they carry the psychiatric burden of the country. And in this month's World Health Bulletin, there is a paper describing the treatment gap, that is, the percentage of people not being treated. And that reaches nearly 90% for some mental illnesses in some Saharan Africans. That's unacceptable. That's totally unacceptable. And that is why I'm delighted to endorse this trust, that you're meeting the needs, indeed, of the poorest. People with stigma, people who've been rejected, people who've been pushed out without hope. And you here today in this plush, is it called the Saints, this place, are doing things for those really in need. And it's a great privilege for me to act as your patron and to be here today. And I wish the trust well. But one word of warning: don't be complacent. Don't say, well, we've done this. Joshua said at one stage, in the words as we celebrate the King James Bible, of course, there remaineth very much land to be possessed. And there's very much health land to be possessed in partnerships for Ghana and for Kintampo Trust. Congratulations and thank you very much.